In early 2021, more Australians than ever are both recognising the importance of their mental health and wellbeing and reaching out for support for services when they're not well or when they're at risk of suicide. It is imperative that we have a system that meets that need. The 2021-22 federal budget for mental health and wellbeing marks a genuine shift in how we do things. It enables a much more compassionate, person-centred approach. $2.3 billion is a commitment that will enable us to lay the foundations for a truly integrated way of doing mental health and suicide prevention in Australia. The budget commitment leads to a shift in three fundamental ways. Firstly, focusing on the value of investing in mental health and wellbeing for all Australians, not just how we spend on mental illness. Secondly, it's increasing accessibility to services both online and in communities where people live, learn and work. A new network of community-based mental health hubs for children and those who care for them, young people and adults will ensure that those services are age and needs appropriate. And thirdly, supporting our mental health workforce across multiple disciplines so they can deliver compassionate, evidence-based quality care. The budget response, the way it's been structured, indicates to me that voices have been heard and listened to. Voices of those with lived experience, voices of those who care for them, and voices of those who have to deliver those services and supports. The budget response is based upon 5 pillars which will allow for integrated and national approach. The first of the 5 pillars is close to $250 million for prevention and early intervention. Investment in mental health and wellbeing requires a new focus on prevention of mental ill health and a new focus on early intervention, early in life, in illness, in episode of illness and in relapse. It also recognises the importance of how employment, economic security and education, as well as the role of workplaces and communities, are directly connected to our mental health and wellbeing. It also works within the challenges of the intersect of mental ill health and the justice system. It recognises the importance of a whole of person, whole of life, whole of system approach to mental health and wellbeing. It needs to be accessible via integrated and easy to use digital services, channels and infrastructure so that all Australians, regardless of where they live, can access the services they require. The second pillar is close to $300 million for suicide prevention. This represents a commitment towards early intervention, early in distress for somebody who is approaching risk of suicide. It also recognises the imperative of ensuring that we're providing evidence-based universal aftercare to anyone who's been in suicidal crisis and to those who have been bereaved. It shifts towards a provision of suicide prevention services that address the needs of those who are disproportionately impacted by the risk of suicide. And it establishes a National Suicide Office to ensure that a truly national approach is achieved across all jurisdictions. The third pillar is $1.4 billion for treatment. Such a significant investment delivers on the need to bring more service options into community settings across the spectrum of children, young people and adults. By establishing a network of hubs, a new approach is being taken to bring into effect a more coordinated approach provided by multidisciplinary teams across our GPs, our mental health professionals and our allied health services. This whole commitment delivers 57 new centres. These centres respond to people as a whole person, regardless of their life experience and their needs. In effect, it responds to the needs of the missing middle, those who have not been able to access the services they need, often because they are too unwell for primary care, but not so unwell that they need hospital. It is a significant shift towards our goal of a universal mental health care system which provides affordable, accessible care to any Australian when they need it and where they need it. The fourth pillar is $107 million to support priority populations. We know that mental health services need to be accessible to priority population groups, recognising that one size does not fit all. The provision of equitable access to services by creating additional support for particular groups recognises that the experience of each person is different. The particular needs of our First Nation communities, our culturally and linguistically diverse communities, those who identify as LGBTIQ+, those who live in regional and rural Australia. We also recognise the importance of providing support at key transition points in life, including our veterans. The fifth pillar is $200 million for our workforce and for governance structures, critical to achieve a whole-of-government approach. Ensuring our mental health workforce is supported to provide compassionate, safe care is a critical enabler for our system and our service reform. By offering over 1,000 scholarships and clinical or training placements, together with further training opportunities and incentives, this component of the budget seeks to broaden our mental health workforce, increase our capacity and improve capability. It recognises the importance of all of our disciplines, our GPs, psychiatrists, psychologists, nurses, and across our allied health professionals. Most importantly, it both recognises and supports investment in our peer workforce. In terms of a whole-of-government approach, the budget commits to making the National Partnership Agreement a reality. Key to achieving lasting reform will be strong collaboration across all governments, across the sector, and across our communities. It also includes a commitment to co-designing solutions with people with a lived experience. The implementation of cross-portfolio responsibility will see improvements in data collection, outcomes measurement, and the capacity to provide support to people at all stages of their life while addressing the social determinants that influence their mental health and well-being. We welcome the continued investment in collecting improved data, ensuring we have the right research approaches, and most importantly, that we measure outcomes for people, not just how busy the system is, but how effective it is in meeting the needs of people. The 2021-22 federal budget for mental health and well-being and for suicide prevention marks a genuine shift towards a more compassionate, person-centred approach to how we provide services and supports. $2.3 billion is a significant commitment which will enable us to lay the foundations for a truly integrated national approach. It is a critical step towards a universal mental health and wellbeing system that ensures that the needs of any Australian are met when it comes to their mental health and wellbeing.